Good evening to DPF members. Good evening to our viewers and our panelists. See, COVID-19 has created havoc, and we had the regular COVID, and then Delta variant, and A variant, B variant, and now Omicron. And then there's also some rumors going on that there's one more variant that's going to come. And in fact, there have also been some philosophies that said that lockdowns have cost more than actually the real consequences of COVID, or there are some other people saying, no, COVID lockdowns are necessary and important. So experts' opinion have diverged. In fact, Professor Sunetra from Oxford was supposed to be here. She has always said that lockdowns are a bad idea. So, and we don't know what is a right policy. And maybe I will allow the experts to say more on that. And again, this has also thrown a very important question: healthcare funding. For example, OECD countries on average spend about 8% of their GDP on healthcare. Developing countries like India spend little, and India is the only country, union, but not Tamil Nadu, but the Union Government of India is the only country in the world where the health budget on real terms has reduced after the pandemic. So we can also touch upon that, and we have Professor Indranil who will give overview on what are the right health policies the countries have to take. With this, I would request Kumaran to introduce this panel and moderate. Thank you.
Thank you so much. Yeah, thank you for the opportunity for having me here today as well. So I'm sure all of us are very familiar with COVID, and I think the future is really important right now. And having this discussion panel where we talk about what's going to happen in the future, I think would be really promising. At this stage currently, we know we're at 5.7 million deaths in the world. So really one of the most serious diseases we've ever seen. And there's many other factors as well. Besides just the death, we've seen increased poverty. Figures from the World Bank, for instance, say that there's more than 150 million people at the end of 2021 that's pushed into poverty, to extreme poverty. There's increased hunger as well. There's new epidemics with this. So we all know the problem of the infodemic. We've seen political instability around the world as well. So we've seen where there's been protests against governments, where people are losing trust in governments. But we've also seen where there is success in dealing with the pandemic. It's also important politically to achieve re-election. And also importantly, what the pandemic has caused is it's increased the disparities that we see in race, gender, and data access across the world. And so there's so many issues to delve into today. And without doing so, I'd like to introduce our first panelist, which is Dr. Danapal. And before I do that, I just want to convey sincere apologies from Professor Sunetra Gupta from Oxford. So she just had an emergency to attend to a few hours ago and couldn't be with us today. So many apologies for that. So first speaker, Dr. Danapal. So Dr. Ramasamy Danapal is the mentor of Harley Street Healthcare Group, PCL, and is a qualified as Doctor of Medicine. He has provided professional patient-focused care to thousands of patients spanning over 3 decades. He is an experienced accident and emergency medicine specialist with extensive knowledge in medical emergencies. He currently works for the National Health Service NHS Royal Free Trust and is also a medical advisor to several care homes in the UK. Dr. Danapal, the floor is yours.
First of all, thank you very much for the eloquent introduction. My dear friend P.T.R. Rajan, the curator of the Dravidian Forum, and who conceptualized this concept itself, eminent panelist, Pugal, who has been organized and invited me for this program, and all the backroom staff who have been behind this program. Let me first of all wish you a very good afternoon and thank you. And I'm sure the expert panelists will enlighten you with the technical details and all the numbers. Let me briefly run. I'm from Singapore. I have experienced SARS, and I have that opportunity of being in London also, experiencing COVID. Let us take a bit of lighter vein and explain to you. First of all, Corona is a crown. A crown is either worn by the queen or a king. They are empowered, they are powered people. Today, we have an invisible dictator by the name of Corona. He or she, queen or king, is not visible to a naked eye itself, right? So we have been fighting an invisible enemy. And in all respects, I must say this has been, in my own opinion, it's been a World War III. SARS is all right, we managed it very well in Singapore and Hong Kong, but this has been a World War III. Not only 5 million people have died, about 300 million people have been wounded in this war. What did we have? When it came on, we had no armaments because we were not prepared. We had Hitler, we identified Hitler, who is our enemy. Here we do not know who it was. So our first armament went to basics, because we knew nothing how to control this. The basics was back to hygiene. That's all, hygiene. What did we start with? Face, hand, and space. I repeat, face, space, and hands. Then we came up to catch it, bin it, kill it. That's all the arms we had at the time when COVID was really at the peak of the pandemic. This goes to basic fact that personal hygiene. I remember when I was a kid growing up in Singapore, we cannot sit on our table or get in the house without washing the hand, washing the leg, washing the face. And when we go to school, we're always given, tissues were not available, those days, a handkerchief, cotton pocket handkerchief. You must carry that. And even our teachers will check whether why? To catch it and bin it. We can't bin cotton those days. We're not that rich, you see. Tissue you can bin. We catch it. We bring it home, we wash it and kill it. That basic fact has gone out to the modernization, economization, digitalization. Everybody has gone on that. So this invisible enemy, the first arm we had was basics. Then we discovered the missile. That missile was vaccine. So we had first dose, second dose, and booster dose. Today, the crown has home. The powerful dictator has been subdued to become less virulent. Through mutations and all, they become less virulent. Now is the Hindu word Om Shanti. So we are able to control it. Though infection rates are high, but the mortality rate and morbidity rate are much lower. That I can tell you from UK experience itself. And that doesn't mean, and to create a herd immunity, you have two things. Either everybody gets it, 84% of the population gets infected, or you vaccinate. We had experience with smallpox, chicken pox, measles, and you. About 8.
Sorry, I think we may have lost Dr. Danapal.
I think it's trying to sign in.
For the last 2 years, we've been fighting the war on medical ground, on social grounds, fronts, and economic grounds. Many countries' economy is devastated. Can you hear me? Can you hear me?
Yes.
Hello?
Yeah,
Yes,
we
sir.
can hear you, doctor.
Can you hear me?
Yes, doctor, we can hear you.
Hello?
Yes, doctor, we can hear you.
Hello? Can you hear me? Hello?
Yes, doctor, we can hear you.
Hello?
We can hear you. We can hear you.
Can you hear me?
Yes, we can hear you.
Communication disruption. Okay, cool.
Yes, yeah.
So
Please continue.
where was, I mean, the economy is in devastation. Yeah, right. Today, if you look at the British economy, if you look at British, the poorer countries have become poor due to the war. The richer countries somehow have survived to come out. If you look at the economic growth of China and in India, the finance minister has predicted 8 to 9% growth. China has been predicted also 8 to 9% growth. UK, we are predicting 4 to 5% growth. All the economies, that developed economies, are progressing, getting out of it. But the poorer countries in Africa and other parts of Asia have been suffering. So what as I said, we cannot be cocooned and stay away from this virus. We have to learn to live it. We got to learn to love it. How? But we have to protect ourselves. We have to either, I'm a great believer in vaccination. The most vulnerable should be vaccinated. Children, we are vaccinating children below the age of 15 with parental consent in UK. So the next step to come out of this doldrum, come out to break the circle, we have to love coronavirus, learn to live it. You see, we cannot eradicate. We haven't eradicated smallpox. We haven't eradicated HIV. Right? A virus is coexisting with us. There are many viruses in our system, in the skin and system, and they can mutate and cause a war itself. So what do I say is that herd immunity can be attained. Either everybody getting it. Omicron is doing. I strongly feel Omicron is doing that in a way, but nobody is. I mean, okay, fine, you get infected on the basis, but but you got to improve your immune system. No amount of vitamin C, vitamin D, all the supplements you add on to that, nothing like your positive thinking. Positive thinking is like Boris, the Prime Minister of UK, has been very positive to get out of it. Okay, fine. We have a problem, let's tackle it. See the problem and we'll tackle it. So positive thinking is very important. Positive thinking boosts the immune system automatically. I need not tell you. I think if Dr. Smitra was there, she can also tell you. Then the next one is personal hygiene again. Simple, go to basic. If you look at the Quran, you look at the Hindu literatures, Bible, all our old texts, Testament says health, hygiene. Cleanliness is cleanliness is more important than godliness. Both basic. Then what is God has given us? Exercise. Just to exercise. Those diabetic, hypertensive, all that, exercise. It helps your metabolic disease itself, and also helps you to prevent getting the infection. Then diet. And I strongly advocate to everybody, though the vaccine is a bit new, I mean, not many of them will say it's not tested and tried, but you have nothing else, my dear friends. You have nothing else except vaccine. Or you become anti-vaxxer, you face the consequences. Right? Like Singapore, I will tell you, I mean, a bit wrong. We have introduced in Singapore a policy. If you are vaccinated, if you have illness, we will treat you at our expense, at government expense. If you are not vaccinated, if you have COVID, then you pay for your treatment, whatever complication comes in, right? So this is a clear message. Mandatory vaccination in Singapore, we are introducing. And also in UK, NHS have introduced mandatory vaccine for healthcare workers, right? Because we are treating the vulnerable. We are treating so many people, like an A&E, I don't know what's going to walk in, right? So if I'm not vaccinated, at least I can prevent it. Even if I get the disease, I'm vaccinated, I will get it. All my colleagues, even triple vaccine, are still getting it, but the symptoms are very minor. They're not going to die. Yeah, but I mean, morbidity may a week off sick and all that. So I think the census, there are a lot of anti-vaxxers and all that. I strongly believe in the policies of my government, Singapore government. We did famous SARS. We are doing this further to get up because it's a small economy. You know, for us to grow, we must have the possibility. We must have some. It's a guided democracy. UK is also coming. All NHS workers must be vaccinated. All home helpers in care homes where the elderly are there, the care workers must be vaccinated. Of course, there's some resistance, there's a political jargon going on the people are trying to capitalize this on a political basis. Let me not drag on further. We can keep on talking, but this is public policy, public. What I brought up, it is not, I've been scientific graphs, is a happening philosophy, day-to-day philosophy, the man on the street, because I'm a frontline doctor. I see patients in A&E, I see we do in our clinic itself. This is what it's all about. So, my dear friends, first of all, let me tell you before that, there are few islands that got zero COVID cases. About 10 countries. One is North Korea. You can guess, I'll guess the statistics. North Korea has come up 0 cases, which I think internationally it's a bit difficult to believe, but you have to take the statistics. Then you have the Pacific Islands like Cook Island, Nauru, Karibita, and Tawala, and this is about 10 countries around the Pacific and South Pacific ocean area, bordered by Fiji, New Zealand, and Australia. These are the small islands. There are 0 cases. Recently, I heard that Tonga, which had a tsunami devastated, there's only 1 case in Tonga. So there are, I think these are the cases we've got to study. I said, how did these countries, even a small island, Singapore is a small island of 5.4 million. Hong Kong, it's a small island. Hong Kong had the issues. Why islands like this, there were 0 cases? I think it's worth a case study going to that. Why? Whereas New Zealand is devastated. Australia was devastated. These neighboring countries, and they're very poor countries. This is a very fascinating story that I think some what do you call it, some statistics should go into the country and see what is it the total lockdown, is it hygiene, or what is the reason, or is it so poorly inhabited that these countries have got 0 cases. When is it eminent members of the panel, my dear friend P.T.R. Rajan, who started this, and Pugal, who have taken on the baton and organizing, being very active organizing, and the rest of the people. First of all, thank you very much for giving the opportunity. Sorry, I was supposed to be the last speaker, but I have to run to Manchester. So thank you very much for speaking first. And if I had these are my personal views, personal opinions. Of course, some are based on facts and figures and my personal experiences. If I've upset anybody on this, with my thoughts and philosophy, please, I ask you to excuse me, because thoughts are thoughts, philosophies are philosophies. There are points we can discuss on the basis. With that, I wish you all the best, and let's carry on rock and rolling. Thank you.
Thank you so much, Dr. Danapal. Thank you for imparting your wisdom to all of us. I just have a quick question for you, because I know you have to run away. In your experience, seeing thousands of patients in your practice, what would you say are some of the biggest problems why patients don't want to get vaccinated? What are some of the myths that you hear all the time?
I can tell you with my hands to my heart that many I've converted when they come and see me. It's either religious pressure, right? Religion has played an important role. All the religion, Muslim, Catholic, all religion, but has played an important role. And fake news, rumor mongering, like in Chennai, the actor, somebody died, went for the vaccine, and Vivek died. So it became a big flare up, and everybody went, and then the cases spurred up itself, right? That is coincidental. Right? He had underlying pathology. He must go beyond the underlying. Anyway, he would have had mortality if not a vaccine, because he was, I don't know, whatever his personal condition, he was a vulnerable person at the time. So it coincided. But the media has played it up. The media is not one-sided, it's both-sided. See? So the media takes the best of it, the worst of it. They should take in the best of it, but they take the sensationalize. See, when you sensationalize news, the public are led by media, led by politicians. That's why you have leaders and those are led and those, so this is the way. So when you explain to them, so you must have time. And education is very important, but educate them. There's nothing else, educate. You have the social media, you have the press, educate them, tell them this is what it is, And I'm sure the swing will be coming on this side. But otherwise, I strongly believe, mandatory is important to certain factors, you see. So this way, I think parents, first of all, parents are misinformed. Social media helps them, and also chat groups. Fake news goes through the chat, WhatsApp, Instagram, all the small chat groups. One incident happened, that happened. Like you see the black, black area where suicide takes place, other things like that, same thing, right? I think we have to, the leaders in healthcare, as well as politicians play an important role in this educating, all right? And I think I must compliment both Tamil Nadu government and the central government for tackling this. For a large country, you have come out very well with the economy growing at 8 to 9%, and you got a brilliant finance minister in Tamil Nadu who's doing extremely well for Tamil Nadu, along with your chief minister, Mr. M.K. Stalin. So.
Okay. Thank you so much, Doctor. So educate, and educate. Okay.
Otherwise, make it compulsory. Otherwise, make it mandatory.
Okay, thank you so much.